If you have mental illness or addictions in Ontario, getting access to the right treatment and supports can be challenging, especially for those moving from one part of the system to another, from hospital to community, from youth services to adult services, and between the health and justice systems.
People don't get mental health services from just one part of a system of care. They don't get it just from the Ministry of Health. They get it from hospitals, from doctors, from schools. They get it from community organizations. They get it from both mental health care and addictions care. It's really important in our system to have a better way for all those different parts of the system of care to work together.
CAMH's Provincial Systems Support Program, PSSP, is bridging the gap, making connections where none existed. It's working closely with thousands of partners from education, mental health, justice, the Aboriginal community, and other local organizations to improve the way children, youth, and families access and move between services.
Our role is to try to do two things. One is we're trying to make sure that as much as possible people use evidence in practice. So we're trying to introduce evidence into the way people and systems work. We're also trying to make sure that systems are better coordinated.
PSSP has set up 18 service collaboratives across Ontario. These community-led bodies are made up of key agencies from a cross-section of services and sectors and are focused on affecting change in the local system. For example, in Champlain, the Youth Justice Service Collaborative is working to keep young people with mental health and substance use issues out of the justice system through an early intervention program called Intersections. The program brings together police and community organizations to redirect young people before they travel too far down the wrong path.
Well, I think the first thing that we're seeing is reduced repeat calls for service to the same youth that we're dealing with. That is the number one benefit that we've seen out of this program for parents that have engaged.
Intersections has really provided an opportunity to support these children and families, as well as the police, in knowing that they can just give us a call, they can make a referral, and then we can figure out the rest in working with the family and getting them connected to services.
The Peel Service Collaborative is improving access to mental health and addiction supports for its diverse communities by training faith leaders in mental health first aid, helping them to recognize the signs and symptoms of mental health problems and where to go for help.
We are very diverse in Peel region, and that means we need to reach out for different communities and find out how we could get to their members of their communities and help them out when it comes to mental health issues.
I work specifically with people from the South Asian community. Faith, religion, spirituality is so important and so key to their mental health recovery and healing process. So I'm really excited about how this is actually going to help the community that I serve and I'm from.
PSSP's Aboriginal Engagement and Outreach Team is delivering mobile training and professional development to Aboriginal mental health and addiction workers across Northern Ontario. Over the past year, the Mobile Training Teams initiative has helped provide over 600 workers with the skills they need to deal with the challenges in their remote communities.
There's a lot of suicide, there's a lot of crisis and trauma, so these skills are especially useful to help them in those areas in the community, and resources are sometimes slim, so the more assistance they can get and training, the better.
The training gives them a tool to change the lives of our young people and hopefully guide them in the right direction.
PSSP is transforming addiction care in Ontario with a new package of screening and assessment tools to help identify both substance use and mental health issues among clients seeking substance use services. The result is better treatment planning.
What we've been seeing is better referrals to psychiatry, better referrals to clinical consultation opportunities, the ability to examine the other domains of a client's life.
It represents a standardization of the quality of care that people will experience no matter where they access service across the addiction sector.
Through community collaboration, knowledge translation, and implementation science, PSSP is transforming systems and improving lives, and not just in Ontario.
The PSSP model is a wonderful example that I think many of us international people who work with improvement and implementation have found as one of the most well-articulated and well-run programs to support complex change within mental health systems.
Countries like Sweden, Ireland, and the US are looking closely at this Made in Ontario model as a guide for bridging gaps in their local mental health systems. Clearly, PSSP is making a difference.